So this goes over different medications you can use. I'm not going to belabor this, but I want to show this on the screen. Drug therapy, beta blockers, non-dihydropyridine, calcium channel blockers. These drugs here are for rate control. They tend not to be effective in converting someone to atrial fibrillation to a normal rhythm. The antiarrhythmic drugs, however, have been shown to convert patients to sinus rhythm or to a normal rhythm, but it doesn't last long. I mean, typically most of these drugs, after about a year, the efficacy is about less than 50%. And becomes a coin toss. Amiodarone, however, is a little bit better than the rest. It has a lot of side effects, a long half-life. I tend to use amiodarone more often than the others because, this works better in people, or perhaps best in people with known structural heart disease. But I try to wean the dose as low as I can while I work with them on their lifestyle modification practices. And so let me rotate this back. So in conclusion, you want to get, if you're diagnosed with atrial fibrillation, you want to, work hard to get your health under control. I recommend a plant-based diet, exercise, make sure you get proper sleep. If you have sleep apnea, get that addressed. Do the types of things that you have control over to improve your body's overall biochemistry and physiology to reduce your risk of having chronic atrial fibrillation, also reduce your risk of stroke. And what they recommended for this patient described in the vignette, they recommend that they would, get serum electrolytes, blood tests, troponin levels, identify and treat reversible risk factors. They didn't go into any details about how they would do that. Start on anticoagulant therapy, and then they perform a cardioversion to get her out of atrial fibrillation after about 4 weeks of anticoagulation. And if it recurred, then they'd make decisions regarding further therapy would be guided based on the symptoms of the like. Sometimes you go to atrial fibrillation ablation on a number of different ablation procedures that we've recommended. The catheter ablation procedure is the most common. There's called the Wolf procedure, and a colleague of mine, Dr. Wolf, a surgeon who can go in and isolate the pulmonary veins from outside of the heart, and also clip the left atrial appendage, so that gets rid of your risk of stroke and the like. So let me just share with you how I would manage this patient and give you my basic nuggets on atrial fibrillation. It's a common disease, and it's one that we should be mindful of, but I want to share with you my thoughts. But before I do that, we're going to go to break for a brief period of time. But before we go to break, I want you to, again, hit the thumbs up button, show us a like, subscribe if you hadn't had time to do so, hit the notification button, and also share this valuable video with friends or colleagues. So we'll be right back. Okay, we are back. So thanks for joining us, and thanks for your attention. So real quick, what is my take on atrial fibrillation? As we discussed earlier, atrial fibrillation is a common arrhythmia, one of the most common, or the most common arrhythmia we deal with in cardiovascular disease in the adult population. And the main issues of atrial fibrillation are, as I see it, twofold. One is poor heart rate control, to the point where the heart gets weakened over time and you go into congestive heart failure, which is pretty bad. And two is risk of stroke. And so typically we're working to, at the very least, affect those two contributing factors. But I'll put those aside, but I'm going to step back and think about think out loud with you about atrial fibrillation. And so what is atrial fibrillation? Yes, it's a heart rhythm abnormality, but I like to think of it as an overall manifestation of an underlying chemical and biochemical and physiological imbalance. We've talked earlier in the talk I did on inflammation of the heart, and I talked about how inflammation and increased inflammation, increased oxidative stress had contribute to electrical abnormalities, and some of these electrical abnormalities result in an abnormal calcium influx inside the myocardial cells or the heart cells. This can lead to ventricular arrhythmias or atrial arrhythmias, in particular atrial fibrillation. So we know mechanistically biochemical and physiological imbalance contributes to atrial fibrillation. So I want us to kind of take that understanding and apply it to a greater understanding of saying, well, atrial fibrillation is not just some condition of the heart, but it's an outward manifestation of the heart of an underlying biochemical and physiological imbalance. And so we need to address that biochemical and physiological imbalance. And in fact, you support that argument by showing that atrial fibrillation is associated with other things that are related to biochemical and physiological imbalance, such as hypertension and diabetes and obesity and the like. So all these things are related to inflammation and increased oxidative stress. So if you're dealing with that, instead of just dealing with atrial fibrillation by itself, perhaps we can deal with the underlying cause that's contributing to all of these conditions. So that's why I like to aggressively affect patients' nutritional status, get them to the point where they're able to exercise or sleeping better, and their overall biochemistry and physiology is in line, and then the body starts to correct itself. So I'm getting some questions. Let's see, what questions am I getting before I get to some of my concluding remarks? Even metoprolol, they ask about metoprolol is a beta blocker and it helps with rate control. It has not been shown to be effective in converting somebody from atrial fibrillation to sinus rhythm compared to placebo. And Jackie's reminding me, Stump the Chump tomorrow night at 7 p.m. So everybody send your questions in for Stump the Chump. I guess you can ask questions about atrial fibrillation as well. And what does food do to help? Well, food, if the right kind of food, it decreases inflammation, decreases oxidative stress, and remove the wrong food, the body, the inflammatory processes start to correct or subside. And conditions such as atrial fibrillation become easier to control if they don't just convert on their own. So this takes you to a situation where I was dealing with a patient just last week, a 75-year-old man who presented to us a number of years ago, had atrial fibrillation, congestive heart failure, poor rate control, and we admitted him to the hospital on more than one occasion. The more recent time we admitted him, he underwent pulmonary vein ablation procedure. We started him on amiodarone. He was on blood thinners, and we put him on a diet. We put him on a several detox regimen, and he followed this plant-based regimen for a long time. We did extensive cardiac monitoring. We also weaned the amiodarone while we monitored heart. We take him off amiodarone. He was off amiodarone for more than a year. Still consistent sinus rhythm, not seeing any atrial fibrillation. And so he was on the blood thinner. I think he was on the Pixaban, 5 milligrams twice a day. And so he was being anticoagulated. And so he said, well, can I get off the anticoagulant? So looking at his situation, he's 75 years old. So he has a CHA2DS2-VASc score of 2. But the heart failure was reversed because the heart pumping function went up to 50%. The hypertension was reversed. He has no diabetes, no obesity. He doesn't have sleep apnea. He's, eating a very healthy plant-based diet, 100% time, exercising, working out, and feeling great. And so I made the judgment call to say, okay, let's see how you do for 6 months. We'll just go with an aspirin, even though this article says aspirin doesn't show any benefit. There was a study years ago in one of the warfarin trials that showed aspirin at 325 milligrams showing an interim benefit. Wasn't as good as warfarin, but it was better than placebo in that one trial. So given that information, but more importantly, how well he did, he had an atrial fibrillation ablation. He's done very well in his lifestyle modification. We've seen no traces of atrial fibrillation in the last, I think it's been maybe 4 years that we've been monitoring. So we said, okay, come off the anticoagulant and let's see how you do. So far he's done quite well. And I think it's the best course of action for him. He said, it's my desire to come off medications totally. And we say, okay, let's work with you and we'll make that happen. So I thought it's a good decision to make in him. And, time will tell, of course. And we follow him as well as all of our other patients very closely. So that's the scoop on atrial fibrillation. I hope that was very helpful for you tonight, or this afternoon, I should say. And we look forward to seeing you next week. And until then, keep it fresh, natural, and live.